Choose the correct statement about anabolic steroids. They are androgens with relatively selective anabolic activity. The following is not a legitimate indication for the use of anabolic steroids to enhance the physical ability of sportsperson. Danazol is used for the following disorders except amenorrhea. Select the disorder in which methyl testosterone is beneficial but testosterone is ineffective, that is hereditary angioneurotic edema. Parenteral testosterone therapy in a boy can cause the following adverse effects except cholestatic jaundice. Danazol produces the following side effects in premenopausal women except menorrhagia. Select the drug that primarily reduces the static component of urinary obstruction in benign hypertrophy of prostate and takes more than 3 months to exert its beneficial effect, that is finasteride. The following drug has potent anti-androgenic and weak progestational activity, that is cyproterone acetate. Which of the following is a non-steroidal anti-androgen that is palliative in advanced carcinoma prostate when combined with GnRH agonist? Flutamide. Circulating testosterone levels in men are elevated during treatment with flutamide. Which of the following is a steroid 5-alpha reductase inhibitor that has been found useful in benign hypertrophy and male pattern baldness? That is finasteride. Finasteride acts by lowering circulating as well as prostate dihydrotestosterone concentration. In patients with benign prostatic hypertrophy, finasteride exerts the following actions, that is reduces size of the prostate gland and increases peak urinary flow rate. Estrogens exert the following actions except maturation of Graafian follicle. Estrogen therapy in postmenopausal women has been implicated in increasing the risk of the following disorders except osteoporosis. Metabolic actions of estrogens tend to cause the following except rise in plasma LDL cholesterol. Transdermal estradiol differs from oral estrogen therapy in that it causes less induction of hepatic synthesis of clotting factors. In which of the following conditions estrogen is not the primary drug but is added to progestin as adjuvant, that is dysfunctional uterine bleeding? Which of the following statements most closely reflects the current status of estrogen in postmenopausal women? That is, estrogen should be prescribed along with progestin after considering risk-benefit ratio in the individual patients. Estrogen therapy can worsen the following associated conditions except acne vulgaris. Addition of progestin for 10 to 12 days each month to estrogen replacement therapy in menopausal women is considered because the progestin blocks the increased risk of endometrial carcinoma due to estrogen. The estrogen commonly used for hormone replacement therapy in menopausal women is conjugated estrogen. The daily dose of estrogen for hormone replacement therapy in postmenopausal women is lower than that of contraception. Select the compound which used for hormone replacement therapy in postmenopausal women serves the purpose of both estrogen and progestin with weak androgenic activity. Tibolone. Select the correct statement about tibolone, that it is an estrogenic plus progestational steroid used for hormone replacement therapy in postmenopausal women. Estrogens are palliative in the following malignancy: carcinoma of prostate. Estrogen replacement therapy for postmenopausal women is contraindicated in subjects with leg vein thrombosis, undiagnosed vaginal bleeding, and migraine. In women of childbearing age, clomiphene citrate produces the following actions except decreased FSH and LH secretion. Clomiphene citrate is indicated for the following conditions, that is female infertility due to unovular cycles and male infertility due to oligozoospermia. For the treatment of female infertility, clomiphene citrate is used in the following manner: daily from 5th to 10th day of menstrual cycle. The following is an orally active ovulation inducing agent, that is clomiphene citrate. Which of the following is a selective estrogen receptor modulator that improves bone mineral density in postmenopausal women, that is raloxifene. What is true about tamoxifen? It can induce endometrial proliferation in postmenopausal women. Benefits of tamoxifen citrate therapy include the following except suppression of menopausal hot flushes. The following indication of tamoxifen citrate is carcinoma breast. Tamoxifen citrate is used for palliative treatment of carcinoma breast in premenopausal women, postmenopausal women, and mastectomized patients. The following effect of tamoxifen citrate indicates that it possesses tissue-specific estrogenic action as well, that is endometrial proliferation. The following is true of raloxifene except it increases risk of developing breast cancer. Choose the selective estrogen receptor modulator that is useful in dysfunctional uterine bleeding by acting as estrogen antagonist in endometrium but does not alter vaginal epithelium or cervical mucus, that is ormeloxifene. Progesterone administration suppresses onset of menstruation. The 19-norprogestin differ from progesterone derivatives in that they have potent anti-ovulatory activity. The distinctive feature of desogestrel include the following except it has additional androgenic activity. Actions of progesterone include the following except endometrial proliferation. Select the progestin preparation for co-administration with estrogen for hormone replacement therapy that does not counteract the beneficial effect of the latter on lipid profile due to lack of androgenic activity, that is micronized oral progesterone. Select the indication for which a progestin is used alone without combining with an estrogen, that is threatened abortion. Side effects of cyclic progestin therapy include the following except, that is irregular bleeding. Addition of progestin for 10 to 12 days every month to cyclic estrogen replacement therapy during menopause is recommended because the progestin prevents irregular bleeding and blocks increased risk of endometrial carcinoma.